the governor's home. I've been there. If this was in his neighborhood, they'd be digging up the streets now, changing the pipes going in. To say to poor people, stand in a hot sun, to say to poor people, you're going to get two cases with 24 bottles in it, and I'll see you next week, is really asinine. Governor, your actions is speaking louder than your words.
Welcome to the Real News Network. I'm Mark Steiner. Great to have you all with us. Newark is the latest community to grab the headlines about the ravages of lead poisoning. Newark, Flint, Baltimore, South Bend, Indiana, across this nation, there are at least 3,000 communities with lead poisoning rates that double Flint's, that match or go beyond Newark's, but they're not in the headlines. Each time this comes to our attention, most state governments seem to not understand that these are public health emergencies. Most of these communities are also ravaged by poverty, and most are communities of color. And as Reuters reported, there are communities like Goat Island, Texas, where over 25% of the children had high levels of lead. To Warren, Pennsylvania, on the Allegheny River, mostly white working-class community, where 35% had levels too high. And in mostly African-American communities that are devastated by abandonment and poverty in cities like Baltimore, Cleveland, and Philadelphia, it can be as high as 50% of the people who have been poisoned by lead. So what is to be done? We're joined by Charles Jackson from the Greater Baltimore Urban League. And Charles, welcome. Good to have you with us.
Thank you, Mark. I appreciate you having me.
So let's talk about what your first reactions to these are. I mean, this is, we keep seeing city after city. We've known about Baltimore's fight for dozens of years, for decades. And people have been fighting that in this city as well. But then you had Flint made the headlines, and then it became part of the presidential debate, and Marianne Williamson made that great quote about it's more than just, it's a public health crisis because we don't take care of things. And now we have Newark, where they give communities 2 cases of bottled water and expect people to survive with that. How deep is this crisis? How would you point it? Is this a public health emergency for our states, cities, and the nation to kind of wrestle with quickly?
It is. And when I look at it from a public health standpoint, built environment is a specific indicator of all health disparities. So when we look at the social determinants of health, where you work, live, and play, built environment is one of the major contributors of your well-being, how well you will show up to work if you have a job, how well you will show up to school if you're a child. And so we look at these things, especially with prevention around children and lead paint. Well, if you have cognitive issues, you can't function. And we know this exacerbates issues as you get older. So it is, yes, it is a major public health issue.
I'm going to come to that in a clip I want to play you, but this is a clip from MSNBC with Brian Williams, who is grilling Governor Murphy of New Jersey.
In an abundance of caution, we have gone aggressively to distributing bottled water, opening up testing to, I believe, many hundreds of different data points.
Do you believe this is a public health crisis?
It's a public health challenge for sure. This notion that we're doing something differently in Newark that we wouldn't do elsewhere is completely baseless.
Are you telling me that the folks who are well off in Middletown would be waking up all of these mornings trying to have to scrounge for 16 ounces at a time of clean water for cooking and drinking and all of their daily needs, the same as the folks in Newark are?
We do nothing different in Middletown than we're doing in Newark. I promise you that. The other comment I would make is this is an American crisis. We have a big water infrastructure crisis, and we need the federal government to step up in a big way.
So, I mean, the question is when you watch a clip like this, I mean, I think he's right. The governor, he said at the end of his statement, which this is a national emergency and the government should step up, and we shouldn't hold our breath for this federal government to step up to anything. But the reality is that is a public health crisis. So how should governments respond to this? Whether it's Maryland's government or Missouri's government or Indiana's government or New Jersey's government?
So that is the million-dollar question. So it is 2-pronged. So you said there's a local approach, and all politics are local, and then there's the national approach. So one of the things that each jurisdiction has to think about is disaster preparedness before it happens, prevention before these issues take place. So for example, yes, we already know in Baltimore that the lead paint issue is there. And luckily, we have a government locally that has a child prevention task force that is specifically working on that. Our numbers have gone down drastically because they have put forth a concerted effort early to work on these issues. But every Every city is not like Baltimore. Every state is not like Maryland. And so if we're not thinking about this as really a natural disaster waiting to happen in certain areas or already happening, then we won't tackle the issue as a crisis. I believe the governor said it's a challenge. It's definitely past a challenge in many of these issues, particularly because we're dealing with people of color and and not only people of color, but people who are also poor. And so it's very interesting when he made the comment that we're dealing with the issue the same in both places, because unfortunately, when we're looking at equity, both places may not have the same exact issue, both cities, Newark and the second city that he was discussing.
So when you look at this, do you see it as a challenge, as the governor said, or do you see it as an emergency? I mean, when you talk, because what we're facing here are communities, old communities, yes, that were built with lead paint, that were built with lead pipes going into the house, and they're still happening in places like Baltimore. The kids are being poisoned by lead every day. So it hasn't been resolved. So, I mean, do you see this as a public health emergency?
It is definitely a public health emergency because, again, all of these things compound on top of each other. So if you're in a built environment that is full of lead paint or water that's full of lead, you send children to school. They have cognitive issues. Sometimes it's been shown, studies talk about children who have lead issues also have disciplinary issues. This now affects possibly the political justice issues that take place in the city. So it's not just, again, I know he said the word challenge, but in my opinion, it's a crisis.
Well, let's pick up what you just said. Then we have this clip that was done in an interview here at The Real News with Dr. Lawrence Brown, who's come to The Real News numerous times, interviewed here about this lead crisis a little while back. And I think he pointed out some of what you're saying here. And let's watch what Lawrence Brown has to say. Lawrence Brown has to say he's associate professor of health over at the Morgan State University.
You know, these impacts that have been mentioned are very disconcerting. Lead impacts everything from cognitive impairments, behavioral issues. It creates that. The propensity towards violence is elevated. It's associated with ADD and ADHD. It's even associated in some studies with elevated levels of depression disorder and panic disorder. And not only do we have that crisis, which is subsiding, but it's the low-level lead poisoning, below 10 micrograms per deciliter of lead in their blood, where we could have as many as 200,000 children who've been poisoned since 2000.
Which is a lot of children. And we saw what he said earlier in this narrative was that Freddie Gray, who we all too aware of what that case was, had a 36% rate of lead in his blood. And he mentioned several other cases and like that. So, I mean, this calls to me, there's a couple levels here. Let's talk to them. One has to do with specifically with this. If we know that a lot of children who are poisoned by lead have cognitive issues, that leads to lower test scores and difficulty even staying in school. It leads to issues of violence and short tempers because you can't control your tempers. I've interviewed kids who've been lead poisoning who are almost crying because they can't control when they were angry. They don't want to be angry, and they know it's going to happen to them. So how do we respond to this? I mean, this is, we have, some people have said between 15 and 50% of the people in prisons are lead poisoned. Yeah. So how do we respond to this socially and politically, economically?
And so one of the things that I look at is, okay, there's prevention, but now what do we do after the fact? Right. And so I look at the infrastructure. So what rules and regulations are put into place around testing, particularly for children? The second portion of that is, again, looking at the built environment around it. So we really have to look at the infrastructure of how cities are crafted. Where are you living? This plays a big part, specifically for cities like Baltimore. So if you are in a food desert or a healthy food impoverishment zone, as they're now known as, and they're
healthy food impoverishment.
I'm saying it incorrectly, so I'm sure someone will write in and tell you but it's healthy food zones or something like that. That's the new term that's being said. But if in those zones that are formerly known as food deserts, if there's only a fast food restaurant around, right, that also is an issue because things like healthy foods, fruits and vegetables, leafy greens actually help rid your system of the lead that's there. But if you're already in a older home that has lead issues, and then you're in a built environment or neighborhood that has no healthy food, we have to look at these things in in multiple ways, the prevention, but also the built environment in order to work on these issues. And then looking at the future and around what's going to take place. We see in older cities that now water is an issue. Well, if water and infrastructure is an issue, if you're not working on it, then you have issues that happen in Newark where bottles of water being passed out and you have to wait another week to get more.
So if you are responding to the crisis, let's say in Newark,
yeah.
What should the response be? 2 cases of water a week? That's the response?
2 cases, which I'm sorry, I just have a visceral reaction to that because I think about, okay, that's washing your body, and that's also being able to wash dishes and
clothes and having water for you and your children.
Exactly. So think about how much water we actually use on a daily basis. I could go through 2 cases.
I've had 2 glasses here before we even started this interview.
I could go through 2 cases myself. So in cases like Newark, this is really where everyone will have to work together in order to be able to work on the issue. And sometimes that means also getting outside help. There's organizations like Black Millennials for Flint. Will Smith's son had literally put up water filtration systems or water systems in different cities where people can actually go to them. So this is sometimes where I know that cities oftentimes look within, but sometimes it may be a without look as well to be able to really get some of the needs met quickly because cities unfortunately can't do everything themselves.
So, no, they can't. I mean, and given where most cities are in this country. And I think that, so how do you respond to this? I mean, what I'm asking specifically is, A, it seems to me you have to do some massive rehabilitation in people's neighborhoods to get rid of lead and lead paint and the lead pipes and replace all of those and or move people out into decent housing where they're not worried about lead paint and lead poisoning. That's A. And B, there are the social consequences. How much, what do we have to do, what do we have to spend to ensure that young people who are poisoned by lead as become adults are taken care of? I mean, these are huge, massive amounts of money for both these things.
Yeah. And well, unfortunately, when you don't take care of something beforehand, you have to take care of it afterwards, and you end up having to spend more money. So I don't know what that exact number looks like. Each city is different, but you're 100% correct. Newark is going to have to do all of those things in conjunction with each other. And governmental organizations and public health organizations and community organizations, faith-based organizations, really going to have to work together in order to be able to get that information out around what is being done. Transparency is needed. As we've seen, it was unfortunately was not the case in Newark. And then also getting, if it's a public health issue, in my opinion, public health officials should be leading the charge, not those who are not subject matter experts on the issue.
So what lessons do you learn from the work you've done for the rest of the country?
Goodness. So working around the country, awareness on the local end is key. Now, each disparity is different. So I've worked, whether it's been on HIV or immunizations or cancers, always key has been awareness, letting the public know what the issue is and how to change it. The second portion has always been, once you've made people aware of what's going on, then giving them the opportunity or the space to be able to become healthier. And so in regards to lead, again, we look at I keep on getting back to it, but that built environment is key. And I know you said something about, can we move people out of their locations and bring them back? Unfortunately, if we do that, we've seen cases in certain cities that when you move people out, they're not able to come back in once the issue has been fixed. Because that's when gentrification sometimes happens, because when people see a vacant space and say, well, you know what, this is a space that's in a nice area, it's close to downtown, you know what, we need to revitalize this, or urban renewal. So it has to be looked at from an equity lens as well as what are the needs of those people who are in need right now. And if it's multiple cities or multiple neighborhoods that are affected, which neighborhood needs are met, which neighborhoods have XYZ needs right now, because each neighborhood may be different. Again, for example, in Baltimore, you may treat Roland Park a little bit differently than you treat Cherry Hill. Needs are not the same.
So, just to mention those neighborhoods, I mean, it was like when they talked about the governor of New Jersey, you talked about 2 Baltimore neighborhoods, Cherry Hill being poor and black, and Roland Park being mostly white and really wealthy, and how we treat these neighborhoods very differently. So are you? And so what about policy changes to kind of address these issues? I mean, how? I mean, that seems to be the crux of the issue.
Yes, I would really like to see on the local level as well as the federal level money set aside for research in regards to lead issues, but then also money set aside for implementation around how to make communities aware of the issue and also how to take care of the issue on the back end around after you get testing, what are your steps, being able to take families through the process of getting their needs met. And each family may be different. So if that is some type of fund specifically for those who have an elevated lead level, then so be it. It has to be on the macro and the micro level in order to be able to take care of this issue. And of course, on the bigger end, cities are going to have to really build up their buildings as well as their water systems in order to stop the issue.
Charles Jackson, it's good to see you. Thanks for dropping by the studio. Good to have you with us here at The Real News.
Thank you, Mark.
And I'm Mark Steiner here for The Real News Network. Thank you for joining us. Let us know what you think. Take care.
Thanks a lot for watching. Appreciate it. But do us one more solemn favor. Hit the subscribe button below. You know you want to. Stay up on the videos.